Hello, participants and speakers. Welcome. My name is Shannon Hader, and I'm delighted to welcome you to this IAS Satellite Session on the 2025 AIDS targets, the next generation of goals for the global AIDS response. Progress towards ending AIDS as a public health threat has been highly uneven. Global goals adopted in the 2016 Political Declaration on Ending AIDS were not met last year. And the COVID-19 pandemic, its devastating impacts everywhere, have thrown us further off course. That said, seeing that some countries did achieve and even exceed specific targets shows us how important these globally adopted and visible targets are. When we see that very different countries, different in geography, wealth, size, and type of HIV epidemic, have exceeded certain targets, then we have evidence that validates that these targets are in fact possible, achievable. They are not aspirational. And in order to get back on track, we can't just follow business as usual. It's not simply doing more of what we've already been doing in an incremental, step-by-step way. We need to go further. We need to do better. We need to look for opportunities to surge and shift. We must recognize the disparities in health outcomes across and within countries and tackle the inequalities that drive new HIV infections and prevent people from accessing the services they need. The new ambitious political declaration adopted by member states at last month's UN General Assembly high-level meeting on AIDS has been built on these 2025 targets and will allow us to get back on course. As you'll hear, the new set of evidence-based targets for 2025 have been developed through an inclusive and participatory process. They're focused on reducing inequalities and disparities and addressing the legal and social barriers to HIV program effectiveness that hurt societies as a whole. The targets include impact estimates. What will be the effect on reducing new HIV infections and reducing death from AIDS by achieving these targets? And they include estimates of the resources needed for the AIDS response annually up to 2025, including a target of $29 billion to be mobilized by 2025 for low and middle income countries. We know that for the last 5-year plan, the world did not invest fully, did not invest the estimated resource needs, and the world did not achieve the targets. And failure to achieve the 2020 targets means our bill or our resources needed have increased rather than peaking and going down. Only by ensuring the needed financing will we end AIDS everywhere. In this satellite session, we will hear from the speakers about different targets and from communities of people living with HIV and from national programs on what is needed to ensure that no one is left behind. The targets are ambitious and necessary. In order to close the gaps in HIV testing, treatment, and viral suppression that are limiting the impact of our HIV response, the 95-95-95 testing and treatment targets must be achieved within all subpopulations, within all age groups, geographic settings, and including children living with HIV. We must also ensure that HIV prevention is prioritized so that 95% of people at risk for HIV infection have access to and use appropriate, prioritized, person-centered, and effective combination prevention options. And we can only achieve this if we simultaneously address HIV-related stigma and discrimination, gender inequality, and we also create supportive legal environments, including access to justice. Ending AIDS as a public health threat by 2030 is possible, and key milestones have already been achieved in selected countries. The 2025 targets give us the signposts to get back on track and achieve our goals as a globe. So thank you for joining us in this very important session.